What's worse at the doctor's office, exaggerating your symptoms or withholding information or minimizing your symptoms?
They're
Both bad.
I mean,
yeah.
I think when you go into the doctor's office with something that's been going on for a while, you're embarrassed, and you might say, yeah, it's been about a week when it's really been 2 or 3 weeks. But that makes a big difference in how I'm going to assess you.
It's not divulging information. If you exaggerate, well, at least...
I actually disagree.
Yeah,
I think what's
be-
worse is if you exaggerate your symptoms and you come into the emergency department and I press on your abdomen and you're like, ah!
Yeah.
And it doesn't really hurt that bad, well, you're going to get... We may think you have appendicitis. You may get a CT scan you don't need. You might,
Yeah,
if
but
you
how
say your
about chest
headache...
pain? What if you're having chest pain and you don't say anything about it versus, oh, my chest pain is killing me, but maybe it's not that bad, and you ignore this.
Now, I agree
symptom.
with you, but actually, this is one thing that I've seen, and it's in my opinion, more detrimental to your health in some cases. So some people have figured out that if you say you have chest pain, you may get seen more quickly in the emergency department. But by the time you get back and see the doctor, everyone's, oh my gosh, this patient has chest pain, they may be having a heart attack. Well, you may be seen more quickly, but you also might have just bought yourself a stay in the hospital, a cardiac stress test, X-rays, maybe even CT scans, multiple EKGs, medicines that may or you probably don't need if you don't really have chest pain.
And you've seen this happen. He goes, oh, chest pain, but by the way, I also have athlete's foot. Can you check that?
So maybe in the emergency department, I feel like if someone comes to the emergency department, I know something's wrong with them. So if they're minimizing their symptoms, I can tease it out of them. But if you exaggerate your symptoms, I have no clue what's going on. All of a sudden, my scent is off because I'm chasing things that aren't really there.
Yeah.
But if someone shows up, if they've made the decision to come to the doctor's office, what I have found, it's obviously, just be honest, but if I can't tell you how many men I've taken care of who you'll say, does your chest hurt? Well, just a little bit, doc. And you can instantly tell that this is someone trying to be stoic. And it doesn't throw you off. Instead, you'll ask the next question, which is, something's not right with it, is it? You'll say, no, doc, it's not. Versus if someone essentially lies and says, oh yeah, this is hurting when it really isn't, then you have no clue what to do as a doctor.
People also worry that we're going to judge them, and it's just so not true.
Too.
We are not there to judge you. We are there to treat you and help you and heal you, and that's it.
And we
That's
can
it.
best help you if you're completely honest.